It's really great to see all of you out here tonight. I know all of that information was pretty basic that you heard, but I'm going to try to lighten it up just a little. I get this question all the time. Sometimes it's not even that easy for me to answer, but on the most basic level in terms of social work, the primary mission is to enhance human well-being and help meet basic needs, with particular attention to the needs of the vulnerable, oppressed, and poor people. But in terms of an oncology social worker, that's a specialized discipline. And most people really don't, even sometimes some of the team members that I work with don't understand. So it's important for us to continue to try and educate the public and the team members that we work with and patients about what it is that we do. And hopefully I can explain that. Basically, what is an oncology social worker? It's someone that's really here to help you through the cancer journey. What does that mean? What is help? Well, it's different for every single patient, every family. So when I'm asked to meet with a patient or family for a variety of different reasons, I completed a psychosocial assessment. And just like your treatment here at NYU, it's individualized, and there's not one size fits all. So part of the psychosocial assessment, basically, the psychosocial assessment is supposed to really express all of the dimensions of a person, whether it's personality, where they come from in terms of their background, their ethnicity, religion, whatever's important to them. And so after meeting with a patient, completing a psychosocial assessment, it gives a social worker a better sense of how to help the patient in terms of capitalizing on their strengths. So one part of an oncology social worker's role basically is to help them access resources, information. So some of that information might be related to basic things like, transportation resources or different governmental programs, whether it's Medicaid or Social Security, different benefits related to how to help them in terms of supplementing their income during their treatment. So basically, in terms of clinical practice, I work among a multidisciplinary team. So I work alongside the nutritionists, the genetic counselors, the nurses, and infusion nurses, and we all speak together and try and come up with a plan that will be beneficial for the patient and family. And so in meeting with each patient during the initial psychosocial assessment, I try and get as much information from a patient and family as possible and basically learn really what is important to that individual, what is important to that patient, kind of get the essence of that individual. So, we all know that cancer affects not only the patient, it affects everyone. It affects the family, whether that's at home or, whether your family lives abroad. And so the oncology social worker is basically, is not only concerned about the patient, but also, how are the kids doing if you have kids in school, and what information do they know? Are you sharing the diagnosis with them? How are they being impacted in terms of grades, or it's different milestones. Different milestones. How difficult is this for them? So basically, I can be there as a tool, a resource to help them through that, and to make sure that they don't feel alone, because a lot of times some of the side effects and just having a diagnosis of cancer makes individuals isolated at times. And so you can reach out to me, call me, or meet and in person, and hopefully some of those feelings can diminish.
Sorry, real quick, you could view your notes on here if you want to. I'll leave that there for you and then hit cancel and just advance.
Okay, thanks. Okay. Just gonna, for time purposes, I'm just gonna kind of run through these a little bit. 5, okay, thanks. Okay, so let's see. That's great, thank you. So I promise you that if you meet with an oncology social worker, whether you're interested in doing it initially or not, it's not going to hurt. Okay, I'm not going to even pay attention to these slides. So basically, I don't know. I know I keep saying basically all the time. I'm sorry. This is just kind of thrown me. But I'm just take 1 second. So just, kind of take a chance, try and open up when you meet with the social worker. Maybe some of the things that I might be looking at are if you happen to have a past trauma or are affected by, or someone that has had cancer and you've witnessed some of maybe the changes or have some anecdotal information about the diagnosis. That's helpful for me to know. Because then, if it was a long time ago that this person had the treatment, then, things have changed a little bit. We're managing symptoms better. It might be a very different experience. If you were a child and you recall, someone in your family, your mom having the disease and, perhaps dying with the disease, that's going to have, lifelong implications. So one question I get a lot is about support groups. They're for some patients, not for everybody. It's really important to make sure that if you do go to a support group, ask the facilitator whether there's been any screening for the group or if it's kind of just a group where anyone can attend as long as they meet the criteria in terms of the diagnosis. You want to try and make sure that some that there are patients that are kind of appropriate for the group. But we have groups. We have many groups at NYU. We have groups that if we don't have the group, for example, right now we don't have an active gynecologic cancer group, so I can refer you to Cancer Care. They have the first Wednesday of every month from 6 to 7:30. They have a group, or I would refer you to Share, another organization for ovarian and breast cancer patients. Basically, long story short, I think oncology social workers have a lot of information, and it's important to just ask us random questions. If you're trying to reach the team, have trouble reaching them, let's say Dr. Levine is in the OR or he's in the lab, call us, and we can try and kind of work behind the scenes and get you the information or the help that you need. So in terms of practical support, I got a call earlier from parents asking, how can we, what should we expect with chemotherapy? Our daughter's starting treatment next week. And so one thing I'd say is, try to go with the flow. There are probably going to be delays from time to time in terms of when you get an infusion room or when a doctor is able to see you because of obvious reasons with regards to other patients and what's going on with them. So just know that it's not going to be, this precise outline. And if you're told, let's say, for example, that, after your treatment is 6 cycles and it's expected to end December 27th, just know that it's completely a rough estimate. And many patients, don't follow that continuum. And that's okay. Just just know that it's not going to be, you're going to have peaks and valleys. And really, honestly, you're never bothering. I hear so often, well, I don't really want to bother the doctor, but so please just let us know, because in many cases, maybe the doctor isn't the one that's actually following through on this particular task. And we're communicating with the team, we're communicating with the doctor, but, maybe the doctor's not writing the letter. Dr. Levine does write very detailed letters, they're really good, but maybe not all the time. So don't worry, please, we want to know. We want to help in any way that we can. So I think these slides were all the way at the, okay, good. So I think you got these handouts, but essentially these are some of the issues that I often speak with patients and families about. And these websites I think are really helpful. They really cover everything. So sorry for not being able to kind of explain this in a cohesive way, but I think a lot of these programs do a very good job, whether it's online, on a telephone support line, or the information that they offer in webcasts or seminars, or just factually. But some of these topics are a little bit more difficult to talk about than others. Others are really straightforward.
If anyone didn't get one on your way, and there should be extras outside on the table.
And I do really think that it's important for patients to consider some of the survivor and matching programs that are out there. So many of them have, not only can you be matched with another patient with this diagnosis, whatever your diagnosis is, you reach out to these programs like Immerman Angels, and you can tell them, okay, I'm interested in speaking with somebody that's my age, someone who has completed such and such in therapy or in treatment and maybe has a recurrence. You can really get pretty specific. But also many of the organizations now are able to connect you with family members for those individuals with that are being treated. So that can be extremely helpful, because to be honest with you, while we have a lot of information as a medical team, as a multidisciplinary team, we don't know exactly what it's like to have a gynecologic cancer. And these other survivors, throughout the country that are involved in all of these organizations, they do. And finally, I think something that always comes up is financial assistance. Some patients are understandably uncomfortable disclosing financial information. I totally understand that. So if you're having, I always do, but in the initial psychosocial assessment, I just try to get a sense, did the patient, are they having any financial issues prior to the diagnosis? If they are, hopefully they'll be able to share that with me, because obviously cancer happens, at any point in time. And, you're just living, doing your normal thing, and then you get a cancer diagnosis. So you can't really plan and kind of carve it into, your life in a way that makes things easy. So I know information and foundations and other organizations and grants that can cover a lot of financial needs. And so just ask me. We have financial assistance for patients towards hospital bills, also these physician visit bills and chemo bills. And you may think, I don't meet the criteria. There's no way I meet the criteria. Well, some of the foundations aren't based on income. So please just let me know. And we all know that, this is something that you don't have to have very limited financial resources to be struggling. You can be a very high income earning patient or family and, really be getting hit as well. So I always think that, if there's a resource out there, you should apply for it. And it's my job to make sure that that you can, and I kind of do the hard work. And I always ask patients, or I tell them, don't worry about researching all these things that you know online. I have that information, and if I don't know the answer, I will figure the answer out for you.